There's a lot of other candidate assays that are out there, and none have really been proven. I look to studies that will occur over the next year to see some results on that. I think there's two sort of categories that we'll see a lot of activity in. One is genomics, and looking at mutational load or neoantigen load or other genomic methods. And my personal bias on that is while it is an assay that does select patients that have high mutational load, and if you have high mutational load, you have a high likelihood of responding, it misses too many patients. It's insufficiently sensitive. That is, there are a lot of patients that have a low mutational load but still would benefit from therapy. And when you're talking about a companion diagnostic test like we are, it's all about sensitivity and not so much about specificity. And I think all the genomic tests are likely to fail due to insufficient sensitivity. The other test platform that's coming out is the immune cell or microenvironment, which has to do with measuring the number of T cells or the distribution of T cells or properties of the T cells determined by co-expression of other markers. And I'm very optimistic about that because of some preliminary data I've seen that method might even select for patients who are PD-L1 negative but have the right microenvironment to respond. And when they get either PD-L1 drugs or the combination of CTLA-4 drugs and PD-L1 drugs are likely to show response. And so I think I wouldn't be surprised if the current FDA-approved tests or the PD-L1 tests are augmented within the next 2 or 3 years with tests that assess the cellular microenvironment.